All right, let's jump right in. Picture this. There's a single gland in your body. It's about the size of a butterfly, and it can go wrong in two totally opposite ways. We're talking rare, dramatic, and potentially fatal if they're not spotted in minutes. Today, we are diving into a true tale of two extremes, thyroid storm and myxedema coma.
So, at the very heart of our story is the thyroid. You can think of it as the body's master metabolic thermostat. Its hormones are absolutely critical for running, well, just about everything. Your heart rate, your body temperature, even how your brain works, and how you burn energy. And because it has its hands in so many pots, when it goes haywire, it sends massive shock waves through the entire body, all at once.
So that begs the really crucial question, right? What happens when this finely tuned thermostat doesn't just get a little wonky, but completely shatters, sending the body into either a blazing inferno or a deep, frozen shutdown?
Let's start with the fire. We're talking about thyroid storm. You can think of it like a metabolic wildfire, where the body's engine isn't just running fast, it's redlining, completely out of control, and threatening to literally burn itself out.
A thyroid storm is pretty much the most extreme, life-threatening version of an overactive thyroid you can imagine. It's this massive, sudden flood of thyroid hormones that pushes your entire body into a state of severe metabolic chaos. And it's often kicked off by some other major stressor, like a bad infection, a serious injury, surgery, or even just abruptly stopping anti-thyroid meds.
The way this presents is, well, it's incredibly dramatic. Patients come in with a really high fever, they're often super agitated, sometimes even delirious. But the defining feature is an intense tachycardia. That's an extremely fast heart rate. The heart is just being pushed way, way past its limits, which can quickly spiral into dangerous arrhythmias and even heart failure.
Okay, now let's flip the script and go to the complete polar opposite. If thyroid storm is a raging fire, Myxedema Coma is a metabolic deep freeze. This is where all the body's systems just grind to an almost complete stop.
So this is the most severe form of an underactive thyroid. Now, despite the name coma, a person might not be totally unconscious, but their mental state is severely altered. It usually happens in older folks who've had untreated hypothyroidism for a long, long time. And just like its opposite, it can be triggered by stressors like an infection or, and this makes perfect sense, exposure to cold.
Here, everything just slows down. We see a huge drop in body temperature, so severe hypothermia, a dangerously slow heart rate, and really low blood pressure. That slowing metabolism also leads to this characteristic swelling, which is called myxedema, giving patients a kind of puffy look. It is a total system shutdown.
So we have fire and we have ice, two life-threatening emergencies that are perfect mirror images of each other. And understanding the difference isn't just some academic thing. In an emergency room, it is absolutely life and death.
And this gets us to the real challenge here. Some triggers, like an infection or a major trauma, can actually cause either one of these conditions. So in this incredibly high-stakes situation, how on earth does a doctor tell the difference between a system in overdrive and a system that's shutting down? Because getting it wrong could be fatal.
And this is where the contrast just becomes crystal clear. Let's look at them side by side. Temperature? In a thyroid storm, you've got a high fever. Myxedema coma? Severe hypothermia. Heart rate? We're talking rapid tachycardia versus a slow bradycardia. Metabolism is either in total overdrive or a complete shutdown. And finally, you look at their mental state. Agitation and delirium on one side versus lethargy and coma on the other. These are the critical clues.
Looking at the triggers really helps to fill in the rest of the picture. See, right there in the middle, you've got those shared culprits we talked about, infection, trauma, certain drugs. But on the outside, you see the unique factors. For a thyroid storm, things like childbirth or stopping your meds are key. For myxedema coma, cold exposure is a big one. Or other health problems like a GI bleed could be the thing that pushes someone over the edge.
Okay, so recognizing the difference is step one. But step two is a flat-out race against time. And it requires completely different strategies to reverse these dangerous extremes and pull the patient back from the brink.
For thyroid storm, the whole goal is to slam on the brakes, and fast. You start with beta blockers to get that dangerously high heart rate under control. Then you hit them with anti-thyroid drugs to stop the factory from making any more hormones, and you use iodine to block the release of what's already been made. On top of all that, you give corticosteroids to help the body handle the immense stress it's under. It's a full-on, multi-pronged attack.
Now, for myxedema coma, the approach is the complete opposite.
It's not about blocking anything. It's about replacing what's missing and supporting the system. The most crucial first step is giving IV thyroid hormone, levothyroxine, to get those levels back up immediately. After that, it's all supportive care. Gentle warming for the hypothermia, respiratory support because their breathing is often very slow, and correcting any electrolyte problems.
So, what's the bottom line here? When we look at these two terrifying conditions, the stakes could not be any higher, which is why getting that diagnosis right, and right away, is just everything.
And let's be really clear about this. Both thyroid storm and myxedema coma are endocrine emergencies with really high mortality rates. The biggest takeaway is that spotting them early and treating them aggressively with the right management plan is what makes all the difference in a patient's chances of survival.
If treatment gets delayed, the complications are severe. Both of these conditions can quickly spiral into heart failure, life-threatening arrhythmias, respiratory failure, and, eventually, the shutdown of multiple organs. This just hammers home why understanding this tale of two extremes is so incredibly vital.
You know, in the end, these two conditions are just this powerful, sobering reminder of the incredible, delicate balance our bodies are fighting to maintain every single second of every day. They show us how one single system, when it's pushed too far in either direction, can threaten our very existence. So, the crucial point isn't just about the extremes themselves, but about the remarkable, life-sustaining equilibrium they so violently disrupt.